2 months into a COVID-19 outbreak, which Kim Jong-un called the greatest turmoil in his country's history, North Korea claims the worst is over. A pandemic that ravaged the rest of the world has claimed just 73 lives so far, according to Pyongyang's figures, a claim universally doubted.
The COVID-19 situation North Korean state media is reporting is quite different to what other countries experienced after an outbreak. So I have some questions.
The world feared an Omicron outbreak amidst an unvaccinated, malnourished population with primitive healthcare could be catastrophic. The UN's Special Rapporteur for Human Rights in North Korea says he's still not able to dispel that fear.
We have some reports about vulnerable people like elder, some children with nutritional problems dying due to COVID. But again, it's very difficult to confront that information at this point.
Chae Jong-hun fled North Korea 11 years ago. He says he worked as a doctor during a measles outbreak in 2006. To diagnose and treat cases, he says he was given just thermometers.
If we have patients with measles or influenza, all we can do is to tell them which medicine they need and how much to take. There's nothing else we can do as we had no medicine at the hospital.
Kim Jong-un toured pharmacies in Pyongyang in May, ordering the military to stabilize medical supplies. But defectors say in reality, patients have to buy their own medicine in local markets, imported or smuggled in from China. Closed borders and recent lockdowns mean there is likely little left.
We were frustrated because the government funded missile programs, not healthcare.
Dr. Ki Park is an American neurosurgeon who used to visit North Korea twice a year to work alongside doctors there before the COVID pandemic.
They struggled to supply the hospital with some of the things that we take for granted. And when they do have some of these supplies, they reuse things until they're unusable.
He says scalpels were reused until they were blunt, but points to recent Chinese customs data from January to April this year, showing Pyongyang imported 1,000 ventilators, more than 10 million masks, and more than 2,000 kilograms of vaccine. Global Vaccine Alliance Gavi said last month they understood North Korea has accepted COVID vaccines from China and started to administer doses. We spoke to one defector who didn't want to be on camera as her whole family is still in the north, but she said she spoke to them by phone a week after the announcement of the COVID outbreak, and they weren't too concerned about the virus. She says what they were extremely concerned about is the food situation, even going so far as to say it was worse than it had been during the late 1990s, when North Korea suffered a devastating and deadly famine.
Urging the government of North Korea, but also parties involved in the Korean Peninsula, understand that there is a serious risk about starvation in North Korea.
COVID-19 not the only deadly threat to North Korea. Paula Hancock's CNN Seoul.